I'm feeling better.
It's all about back pain on Real Health today. And did you know that low back pain is ranked second only to headaches as the most frequently reported case of pain? And as with headaches, it's so easy to pop a painkiller or an anti-inflammatory to deal with the chronic back pain. But in addition to some of the treatments mentioned earlier, what we put in our mouths can affect the pain we experience in our body.
I'm feeling better.
Back pain is a very, very common thing with my clients, and there's occupational stress and the ergonomics of sitting at the wrong desk with their laptop, and yeah, they might be sitting on a bike for too long because they're active, but it's actually still the same posture. And I find modern day stress is very linked into back pain. So with exercise, the trap we fall into is doing very linear motions. Being on a bike, on a cross trainer, on a stepper, even in a Pilates class, we might be doing fairly braced positions where our spine doesn't actually move very much. And also as an strength and conditioning specialist, I always trained clients to hold the spine so the spine's safe during an exercise. But actually now the type of yoga I'm doing is moving the spine across all planes of motion. And I think that's the most important one, given the fact that we're mostly sitting all day long in a very fixed position. So the spine's designed to move, but we train it not to move, and that can be a problem with the degenerative discs. Nutrition and what we eat totally plays a role in back pain. I'm going to give you a thought. Did you know that the whole body pretty much transforms itself in about a year's time? So like the gut lining renews its cells every few days, so that's very rapid. The bones are the slowest, but you're talking about a year or two to actually regenerate a bone. So by making the changes today, in a year's time, your body actually can be completely different. So with that thought, yes, what we put in our mouth can actually hugely affect our tissue structure and integrity. Probably the most powerful component that a diet can play with regards to spinal health is the discs between the vertebrae. Obviously the vertebrae are dependent on the calcium and your vitamin D and so on as well, but often the spinal problems like lower back pain, it might be squeezing of the disc or protrusion of the disc or just erosion of the disc. And yeah, things like collagen is a common ingredient in food that we can get into our body and then actually make more collagen, good quality collagen for our disc structures. If you're to talk about supplements for back pain, for disc integrity, you'd be talking about things like glucosamine and chondroitin, MSM, which is a kind of sulfur. But actually I prefer to look at those mostly from a dietary perspective now. And the best thing that I know of that you can do for this is to make stocks. So we talk about stocks in our book, and you can actually stick some bones and joints from a good organic butcher in a slow cooker, leave it for 2 days with some apple cider vinegar, which just draws the nutrients out. So you're getting a lot of minerals from the bone, but you're also drawing those glucosamine and chondroitin type substances from the joints, and you get in the collagen, which obviously sets up the matrix for the collagen. So yeah, stocks would be my number one go-to. And we also need vitamin C, and vitamin C comes through vegetables and fruit. The fresher, the better.
Some of the vitamins that I see, cited in articles and journals is vitamin D and vitamin K2 to help, I think, again, with the inflammation, but also strengthening bones. What else are you guys hearing about as nutritional supplementation?
Magnesium is really good because it releases muscle spasm, but then it also supports the whole process of increasing melatonin, so you sleep better, and then you go into a deeper sleep, which is also the healing process,
reparative effects
of the body. So that's got its links to that as well. And then I know turmeric is a really good
Yes,
natural source of an anti-inflammatory that you can just add to food or to tea.
And a lot of people don't know that when they consume turmeric, they've actually got to have some black pepper with it, or cayenne pepper with it to help with absorption as well. You know, Jean's mentioned that. Yeah. Another thing that I've read about is alpha lipoic acid. I thought it helps you lose body fat, but apparently oral treatment with ALA improves functionality and reduces the use of analgesics in chronic low back pain patients. That's fascinating. But one thing I wanted to ask you about is increased use of non-steroidal anti-inflammatory drugs and cortisone injections. Apparently it actually increases one's susceptibility to pain.
And it also can do some damage.
Yeah.
I mean, I heard a terrible story about a guy who was a squash player, and he was, you know, in the A leagues, and he loved his squash and he didn't want to give it up. So he went doctor shopping, and every time the next doctor said, no more cortisone injection for you, my friend, he went to the next one and didn't tell them about the history. And by the time he came to actually get realignment physiological, how do I fix this treatment, his entire elbow joint was dissolved.
What?
Dissolved. There was nothing to fix. You could just put your finger right in there and it was just squish. That's a technical
term. Can that be repaired?
No.
Gone.
Because I've
History.
heard that long-term cortisone injections can actually cause cartilage degeneration. It starts to actually, the whole joint starts to
You said more than 3 cortisone injections. Is that in one's lifetime?
it was within a year. Within a year.
Within a year.
More than 3 cortisone injections within 12 months can start to cause cartilage degeneration. So you're having it because you've got arthritis or cartilage problems a lot of the time, and then you're actually having something that can cause or worsen the problem.
It actually highlights the severity of inflammation, because cortisone injections are used as a silver bullet, a panacea at this point in time. You hear from skin conditions to chest infections to sports injuries, cortisone injection.
But I think if it's overused, then it has that other end of the spectrum where you don't want to become reliant on just treating the symptoms. Again, you want to figure out why you have those symptoms and those pain.
Again, because quite often the symptom is not actually anywhere near the problem.
Yes,
It's just the compensation that's acting up.
Well, now you're reminding me, and because I see you're a lovely little skeletal man, tell us about herniated discs or slip discs.
So basically a disc herniation is there's annular fibers that run around the disc, and then you've got a nucleus inside which is like a gel. So the discs sit between each vertebra. These are the discs here between each vertebra. And what happens is the annular fiber from stress or strain, repetitive strain injuries, poor posture, or a sudden major trauma, it can actually tear the annular fiber. And then what happens is the gel starts to push through the fiber, and that's when it's called a herniated disc. And when the gel starts to push through, and it actually will impinge or push onto one of these nerve roots, then that's when you start getting what people loosely term as impinged nerve, or neuralgia, and problems. Problems start to happen from that.
And what's the best way of treating that?
You're getting a herniated disc. Why? Right?
Reason,
So whatever you're doing to treat the herniated disc up front, you also need to go down the line and up the line and figure out why you're getting a herniated disc. And part of this problem is because you've only, your hips have got this massive range of motion. But your spine doesn't have a massive range of motion. Each little disc has only got about 4 degrees of motion available to it. Your knees should be moving just front and back. So they only have that range of motion. Your ankles have this massive, so now if you think about this chain, toes only going like this, ankles going like this, knees only going like this, hips going like this, lower back only going a little bit like this, shoulders all the way around, elbows only going back and forth, wrists going all the way around. So you've got this chain that's supposed to be, you've got motion in particular places and limited motion in other places. So if you limit the motion in your hips because you've got problems down here, you're going to increase the mobility of your lower back because your body has to compensate. It has to keep you upright. And this is why you're getting a problem here, because the back should be able to protect itself. But now you've got this increased mobility in the discs because you don't have enough mobility in the...
And that's where you would come in, Betty, and help with rehabilitation.
So yes, hopefully we can try and reduce some of that discomfort. Well, firstly get some of that pain to go away to a certain extent, where your physios and chiros and other treatment modalities come in, and then we hopefully try and get some stability and strength and realignment happening, get those structures to strengthen up and try and make sure the same thing doesn't happen again. So unfortunately, once you've had an injury, it's quite difficult to sort of prevent it from happening again, but you've got to do as much as you can to make sure that you're not going to have issues.
Are you guys believers in acupuncture?
Yes.
Yeah. You've seen it,
definitely.
yield results as well. And I was never a fan of going to see a chiropractor because I always thought cracking bones is not a good thing.
It feels so good.
But I was none the wiser because chiropractic care seems to be, one of the top treatments. I don't know why is it seen as an alternative therapy? It always pops up an alternative therapy
the physiotherapist.
Why is that?
I'm not actually. I just know that they didn't study at medical school,
so that's why.
They've almost got a different.
They've got an MTech
society. Because we are all registered with the Health Professions Council of South Africa.
Okay.
And we studied with the doctors, and then chiropractors have studied in their own college, so they're now seen almost as a separate entity.
Yeah. And are you fans of chiropractic care?
I think it can work well as long as you've got the right.
It's the practitioner
Yes, it's the
again.
practitioner.
I suppose it's any vocation.
Yes.
I think it's very much about the practitioner because it can be, obviously, and also they've got to have the knowledge and the awareness of what's going on, because if they're just starting to create more mobility in a joint that is actually already hypermobile, then you're having major problems because they're overstretching ligaments in that area where that is where you actually need some stability in the spine. So once again, it's very much about the practitioner. Are they looking at the person as a whole? Are they aware of the fact that that's actually not a place where you should be over manipulating and creating a lot more mobility in those joints? Or are they a good practitioner and they know that you're coming with lower back pain, but you've actually got severe tension in your neck and you've got restricted mobility in your neck, which is meaning that the lower back has to then compensate. So if they start to loosen up the tightness in the neck, that could be very beneficial. But once again, it's very much about the right practitioner, and it's the same in craniosacral therapy. It's about the right practitioner.
Well, they say that prevention is the best cure. Stay with us because when we return, we get the do's and the don'ts of back care.
I'm feeling better.